We continue to battle historic wildfires, but we're also battling this historic pandemic, COVID-19, that has not gone away. That makes some of our wildfire efforts a little bit more challenging, but we are up to the task. We had prepared new protocols, processes, and procedures in anticipation of meeting this moment. We had highlighted and socialized a number of those strategies a number of months ago when we highlighted a supplemental appropriation to get some 858 new CAL FIRE personnel hired, 830 that already now are out on the lines. But we had put together new sheltering protocols. We put together new protocols in terms of taking care of our first responders as well. Let me give you just a brief example of some of those efforts. We now have health screening that is done, an assessment before entry in any of our congregate shelters throughout our system as part and parcel of the evacuation protocols. Mask requirements, social distancing. You'll see not just the use of cots and mats, but not just cots and mats any longer. You'll see tents inside of these facilities that allow us to cohort families and individuals so that they can be more appropriately socially distanced as well as physically distanced from others in these congregate facilities. Also getting as many air purifiers as we can. I want to thank our partners at CARB and others, Bay Area Air Quality Management District, that have been working overtime to get more air purifiers into these shelters. We still have work to do in that space, but progress has been made. But no longer are we just bringing people into congregate facilities. We're also bringing people into non-congregate settings. In fact, the majority of people that have been evacuated are no longer being evacuated into those congregate shelters. They're being evacuated into hotels. We now have 31 hotels, close to 1,500 people that are in those hotel rooms. This is part and parcel of what we built off of through the pandemic. We built new protocols to process these pandemic protocols into our evacuation protocols for these wildfires. In addition, though, of course, to the non-congregate shelters, we do have more traditional shelters in 7 counties, 17 specific shelters, about 731 people in those shelters, but over 2,211 evacuees as of this morning in our shelter system. Many multiple of that, many more that have been evacuated, including into trailer parks. I visited one of those trailer parks in the Santa Cruz area yesterday, and others with family, with friends that may be in need of shelters. So we continue to build our capacity, build our protocols in terms of procuring more hotel rooms to provide as many people access in a timely way that we possibly can. Look, speaking of timely, it is, of course, always timely to remind everybody of the challenges we continue to face in terms of the pandemic itself and the case numbers related to COVID-19. I want to provide you an update. You'll see on this screen of some of the new numbers that have come in, a 7-day average that is continuing to trend downwards. 5,798 is the 7-day average of total positive cases. Yesterday we report in the August 24th number, some 4,946 individuals. Let me highlight what that means with slides those of you who check in are very familiar with. We have about a 6.5% positivity rate in the state of California over the last 14 days, 5.6% over the last 7 days. 5.6% positivity over a 7-day period, 6.5% positivity over a 14-day period. We tested a little over 111,000 people yesterday. You'll see that the 7-day average of daily tests is a little over 102,000, close to 103,000, which is slightly down. Not surprisingly, if interested, not surprisingly, the query of why we're experiencing some disruption related to the wildfires throughout the state. In fact, we have 11 of our own state labs, our Verily and OptumServe labs, that have been impacted very directly by the wildfires. But nonetheless, we're still stubbornly getting over 100,000 tests a day, 111,000 that were reported in yesterday. Hospitalizations on the report that came in yesterday showed a 20% decrease over a 14-day period, continuing to trend in a very encouraging direction, down minus 2.1% in this last 24-hour reporting period. Hospitalizations now, COVID positive hospitalized patients, that is, represent in our hospital system 6% of the healthcare capacity. ICUs, we are down 19% over a 14-day period, actually dropped 3.1% in the last 24-hour period. Again, trending not dissimilar to the hospital numbers over a 14-day period, down 19% over 14 days, and total number of ICU positive patients in our system now, you recall, was 23, 22, 20, now represents 17% of the entire ICU capacity within the entire ICU, entire system. You see this slide, it's a familiar slide, number of counties on the monitoring list for 3 days. What is not as familiar is that we are seeing a decline in the total number of counties on the monitoring list, picking up a little bit on the trend we saw last week from 42 counties down to 40 counties. Today, you see there are 35 counties on our monitoring list. The counties that came off the list include Calaveras, Mono, Napa County, Orange County, and Sierra County. Sierra and Calaveras, you may recall, just recently, I think it was on August 13th and August 15th, Calaveras and Sierra came on the list. Now they're off. You can see the dynamic nature, again, of these monitoring lists. I'll go back. You still see on these 35 lists some of the larger counties in the state of California, but encouraged by San Diego, encouraged by Orange County, encouraged that San Francisco has made some progress. We're going to update. Some more updates will be forthcoming on these slides as we present subsequent information to you over the course of the next few days. But again, progress being made across the spectrum on hospitalizations, ICUs, positivity rate, particularly over the 7-day period, and continuing vigilance in this very difficult period where we're battling this pandemic as we're battling these wildfires all up and down the state of California.